Episode number 304 of the Wholesome Fertility Podcast. My guest today is Dr. Lorena White. With over 20 years of service and experience in the field of women's health, ranging from labor, support, doula to OBGYN, and reproductive endocrinology and fertility, including acupuncture and traditional Chinese medicine, she is a positive disruptor. As the Chief Operations Officer at the Eudaimonia Center, an integrative reproductive medicine and women's health firm, she leads a team that facilitates the health, wellness, and healing of complex women's health challenges, including but not limited to uterine fibroids, endometriosis, PCOS, chronic fatigue, fibromyalgia, and fertility challenges without the use of unnecessary pharmaceutical drugs. She has reimagined what comprehensive women's healthcare could and should be. As a result, she integrated her firm by forming a synergistic flow between conventional medicine and traditional medicine modalities so that the care women receive is not only transformative, but it's also restorative. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. Welcome to the podcast, Dr. White. I'm so excited to have you today.
Thank you so much, Michelle. Glad to be here.
So Lorena and I spoke on her podcast. She had me on her podcast, Women's Health, Wisdom, and Wine. She loves wine. And I do too. And she actually just came back from Paris. So I'm sure you've had some good wine there.
Definitely.
And Lorena, if I may call you Lorena, Dr. Lorena.
We're colleagues. Yes.
So she's incredible. She has such an incredible story. And when I talked to her, I met her the first time, and I actually, before even meeting her, I took her class on fibroids, and it was such a great class. And I remember recognizing her. Your story is so amazing, and I would love for you to share your story because I think it's fascinating. What I love about your story specifically is, first of all, you've been to Cuba, which is freaking awesome. But then also the fact that you have like a foot in both worlds of Western and Eastern medicine and really integrate those two. Yeah. And also what I love about you is that you have a different approach. You really look at people as a whole and really spend time to get to know them and listen to them. It's just that if I can clone you, like,
trust me, I'm working on it. I am trying to clone myself because I really do feel like how we practice and how our firm works is how I feel. And this isn't with no hubris, but how medicine should be. Yes. And I honestly believe that we are better together. And so often it's a us versus them. And that's not just in medicine, but it's, almost in everything. There's just these power dynamics that are not serving the people or the population that we desire to serve. They're trying to serve others' egos. And that's one of the things that frustrate me. That's why I, integrated our firm, because I truly do believe in an integrative approach to care. And we have added a womanist ethic of care to that component that takes it even a notch further. And so the original question was like kind of telling like how I got started or, how I got from.
You have to tell your story because it's so cool.
I'm going to try to like summarize it as quickly as possible. I always knew I wanted to be a physician. I thought I wanted to be a pediatrician. But once I got to my peds rotation, I realized I loved the children, but I could not stand their parents. And that wasn't going to end up with, a good career for anybody nor happy families. And I didn't think I was interested in women's health from the OB-GYN perspective, just because I thought, who wants to look at vaginas all day? Like that's just not seem like something that I wanted to do. However, when I got to that rotation, I started with OB and life changed. Literally, my life changed because from even before I, helped, deliver a baby, it was about, I had been exposed to women's health. I had, been involved with women's circles in my own family through vaginal steaming. I had been a doula, labor support doula. So I had been around that aspect, but I realized there's so much more to conception and childbirth and that 10 months in between. There's so many things that can go wrong, and we don't even talk about those aspects. And so really being able to bear witness to that miracle of birth, I realized that the word miracle is exactly what that is, because we only see those perfect endings when we're on the outside. We don't see the everything that goes on in between and what a lot of moms have to go through, not just to get pregnant, but to stay pregnant. And
Right.
so really being able to bear witness to that miracle of birth, it brought tears to my eyes, and I started wearing goggles because my colleagues are like, "You cry at every birth, suck it up." And I was like, and I tried.
I'd
I
be
was
the
like, "Why do
same.
I do this?" I was like, "Why do I cry every time?" But I'm a softie. I'm in love with love, and I think that mother-child relationship, it's overpowering. It's overwhelming in terms of how intensely bonded that can be when it's healthy and when that whole process just unfolds right in front of your eyes, from the time someone tells you, "Hey, I'm pregnant," or "I think I'm pregnant," to the time like you're literally holding that baby in your hands, presenting them to their parent. So it was amazing. And so by the time I got to my gyne rotation, I also realized, hey, this is so much deeper than I thought it would be. It's about education. It's about empowerment. It's about making sure people know their body parts, and not just with, 12 and 13-year-olds, but also with 41 and 42-year-olds who have had children and still don't know where babies come from. And so I was like, oh, I can be an educator as well through this process. And that was also empowering for me because I knew there was still work to be done. So in between those things, I worked for a federally qualified health center, loved my job, but it was burning me out. I was a sister, a friend, a transportation, a social worker, an interpreter. The good thing is that I do speak more than one language, so that helped. But it was just a lot for what was supposed to be a basic, check it up appointment or an annual visit or, something like that. And it turned into a lot of other things. And when you're helping the indigent and the English as a second or fourth language, and those who just are either immigrants or underhoused or unhoused. I mean, it was just a lot. And as much as my personality doesn't have a switch off valve to say, okay, this is outside your lane. It sees a person who needs help, and it's like, okay, you're the one here and they're asking for you and they're sitting in front of you now. So do something. But I was quickly getting burnt out because there was just so much every single day, that I was getting home just exhausted, happy that I was able to do the things that I was able to do, but still just really, really exhausted and burnt out because there wasn't enough time for me, my family, or the other things, aspects of my life that were also important. And so after that, I was like, I also want to get out of Pennsylvania. And so I wound up working for the Surgeon General during the Obama administration. I was a women's health consultant there, and one of the sweetest jobs I've ever had in life. That was after, though, I came back from Cuba. I lived in Cuba for 6 years. And then I lived in Haiti for 2 years, and that's where I realized what kind of physician I wanted to be. So Cuba and Haiti, back to Pennsylvania. Then when the administration changed, everything for me changed. I knew I could no longer stay in working in that administration the way that I had been. My job was not secure. Things were changing at a pace that wasn't healthy for me, wasn't healthy for my position. It wasn't healthy for my reputation. And so I realized, hey, you're gonna either go back and get an MBA, or you're going to open up your own firm and figure it out. Going back to school, I'm a nerd and I love studying. I love all those things. So going back to school was not even a big deal for me. I had already gone back to school to become an acupuncturist. So going back to school again to get an MBA was just, par for the course for me. But I realized I wanted to do this, and I knew how to take care of my clients, my patients. So I was going to start there. And that's what I did in 2018. We opened up our own firm. I opened up my firm and started with me and 3 other part-time people and practitioners. And now we're up to 15 plus myself.
That's
and
amazing.
We have 2 locations, working on our third. So yeah, it's been a whirlwind. It's like all these good things. It did not necessarily start off that way. Like the first 3 months when I opened the door, I was like, where are all the people? They say you build it and they'll come. And that is not how it works.
Yeah.
You build it and you spend a lot of time looking out the window wondering, is the electricity, is the, phone jack working? Like you pick it up. Okay, there is a dial tone. So the phone does work. Are the doors bolted shut? Like what is going on? And it just is one of those things like building something from the ground up is just not what you see in the movies. There's a lot of heartbreak.
Yeah.
There's a lot of other kind of stuff that goes into that, but it never has been not rewarding. And it definitely has built my character in ways that I didn't know I needed building. Patience is not one of my virtues. And so that definitely showed me, dig deeper and harder and into making the thing that I wanted to see come to fruition fully become what it is now. And it's growing.
Awesome. And also, I mean, really based on your background, I imagine there's not a lot of places like yours.
Not that I know of. When we started, one of my mentors was in California, and she was, shutting down her, shuttering her whole office because she's like, it's too much work, between trying to do all the integrative aspects of things and then insurance, and it was wild. And so just when I was opening up, we had been talking for maybe 3 or 4 months, and she's like, I can't do this anymore because it's just too much work. And I was thinking, in California where everything is so progressive and everybody is, so what I feel is already advanced, and she's having issues. What is that going to mean for me? But I realized I believed in what we do, the work we do, how we do it, our approach. And I bet on myself, and I still continue betting on myself because I don't believe that we got this far just for it to be a flop or a failure. I believe we're steadily growing, and people are steadily realizing that there are other options. Even if it's not us, there's something else out there. And I think part of that is realizing that you don't have to be stuck in the same Western medicine system, not being valued, not being seen, not being heard. And with us, you're seen, heard, and valued. And I think everyone deserves that. And as people are starting to realize that, they're becoming empowered. And whether they choose to work with us or somebody else, they're realizing that they have other decisions that they can make. And they don't have to be stuck in a rut with providers and practitioners that aren't taking care of them.
I think that's huge because I think most people don't really think that they have an option, or they just think they don't even know that anything else exists.
Right.
So talk about that. What's the ideal way a patient should feel? When they come in, what are the things that should be looked at? Because from what I hear a lot is that people want to get certain work done or more blood work done. Say, their TSH is off and they want to do a full thyroid. There's a lot of pushback from their doctors or, oh, you don't need that. Oh, this is fine. And then sometimes even though their intuition, they're like, no, I feel like I need something. And then later on, they find out their intuition was right. They had a hunch. And, it's a real thing, intuition, so because I want people hearing this that are really on the journey, they're going through all of this. I want them to know what they can have, what should be the quality of care that they should be receiving.
Absolutely. And I think that you hit the nail on the head is that, especially as women, we have that thing, whether you call it intuition or a feeling or whatever you want to call it. It's there. And a lot of times we ignore it because it doesn't fall in the parameters of what everyone else is saying or what the doctor told you or what your friends tell you or something else. But you're constantly being told, no, you're normal or you're fine or it's something else other than something that
it's like a dismissal.
Yes, yeah. Yes, that's the word, dismissal. And that's where the womanist ethic of care comes into place, is that when you tell us there's something off and I can't, pinpoint it based on, my diagnostic skills, which I do take pride in, then it's like, okay, then let's figure it out together. What have you tried? What works? What doesn't work? I'm not one for just running a bunch of tests either, just for the sake of running tests. But I also realize that with blood work, physicians primarily get reimbursed on the basic blood work. There's other blood work that is so expensive that is not covered by insurance and it's out of pocket. So they don't run those because they're not going to get reimbursed. Or they're looking at normal ranges. If it's between this and this, it's falling in the normal range, but they're not looking at ratios. And so you're getting your blood work panel back and it says everything's in the normal range, but some of those ranges are not in the normal ratio. So when you're just looking at numbers and everything says normal and they're just saying, okay, everything's normal, but the ratios are off, that's an explanation for potentially some of the conditions or the symptoms that one is experiencing. But also, are they even running the right tests? And if they're not running the right tests or the correct tests in order to make the accurate diagnosis, they're going to continue telling you that there's nothing wrong, everything's fine, to the point of even hinting that it's in your head or you're making it up, which is also one of the things that really annoy me, Because when someone is telling you there's something wrong, and it's not the first time, and it's not the complainy Janies, but someone who does the things, and you can see that they've been at this for years, months. Now's the time for me to listen, because there's something that's clearly not being addressed. And that's where, again, where the womanist ethic of care comes into place, because if I don't have the answer, we're going to seek and find it together. I do believe I'm a solution finder. I don't call myself a problem solver, because who wants to chase problems? I don't.
I love that,
find
solution finder. That's
yes.
awesome.
Yeah. I mean, who you run away from problems. You don't run to them, but you run to solutions. Yes. And so when we're working together, talking about your symptoms, really asking the questions that we learned in acupuncture school that we never ask in Western medicine. We're talking about your sleep, your diet, when you eat, how you eat, your, bowel movements, your urinary habits, your sleep, your, whether you dream, are you hot or cold, all these idiosyncratic questions that are never asked in Western medicine. But they're more comprehensive, because if you have trouble falling asleep or trouble staying asleep, mean two completely different things. And when we just ask, how are your periods? And someone says, okay, regular, good, mean absolutely nothing to me, because it tells me nothing about you. When I ask you, how are you sleeping? And you're saying, fine. I don't know what time you go to bed. I don't know what time you wake up. I don't know if you wake up 3 times in the middle of the night. I don't know if you're having hot sweats in the middle of the night. Are you dreaming? Are your dreams vivid? How many times is this happening per night? Some people think that if they're dreaming, it's a good thing. But when you're dreaming and you remember your dreams, you might as well be awake. So you're not waking up well rested, because your mind is still going. Your mind is still engaged, just like my mind is engaged right now as I talk to you. So if you're remembering your dreams every single night and they're vivid, you're not well rested. But some people have been thinking, I have a dream every night, or I have these very wild dreams. And they're thinking it's something.
Right. This is all Chinese medicine. Yeah.
Yes. Yeah. And it's like, whoa, no, those vivid dreams are actually keeping you from getting a well-rested night's sleep. And yes, we all dream, but for the most part, you don't remember them. And that means you've been in deep sleep and getting that well-rested restorative sleep. So they're just nuanced things like that I find that we do differently, and really help us be able to get to the healing aspect of things instead of the symptom chasing things. And so when we really take time to ask the right questions, to get the right answers, we're able to get results with clients that have never been able to get results in any other capacity, because we're looking at the root cause, the underlying condition, and not just the constellation of symptoms.
For sure. And one of the things that I hear a lot is, the unexplained infertility diagnosis. Yes. And I'm sure for you specifically, you're like, wait, because you look at it in so many different ways that you could probably pick up on things that the next OB will not be picking up on.
Right. Yeah. Well, I think unexplained infertility, and we always like to say fertility challenges instead of infertility, because that kind of borderlines on like,
I know, I don't like the word sterile, the I word either.
And it could be your ovaries, it could be your womb, it could be a lot of different things. So you're just having fertility challenges. And so when I look at unexplained, my thing is, okay, maybe it's unexplained under Western medicine guidelines. But when I look at things, I'm looking at, okay, let's look at your period in all its 4 stages. Is it the follicular phase? Is it the luteal phase? Okay. Is it menstruation? Is it that second part of your follicular phase? Are you ovulating? And is your luteal phase short or long? And are you hot? Are you cold? Like all those different aspects. How healthy are they? So if I look at your cycle length, and your cycle length is 21 days, you're probably not ovulating. And if you are ovulating, then your luteal phase is probably super short. And even if you had a perfect product of conception, there's no place to land. So now we're dealing with, is it your ovaries or is it uterus? So, and then, the other end of the spectrum, if your cycle length is maybe, let's say 45 days, and we're talking still consistent 45 days, then you're probably not ovulating till more toward like day 28, day 30, something like that. But everyone's telling you, oh, you ovulate around day 14. So you're having sex around day 14 and there's no egg there. You're not getting pregnant. So I think a lot of those things are just the easy things that we take for granted. And then when there's irregularities, what is the irregularity and where is it coming from? And I am not, I'll say it out loud, I'm not an advocate of birth control, because it is a synthetic hormone and an endocrine disruptor. And when people are on birth control for years at a time, or sometimes decades at a time, it messes up the whole entire menstrual cycle, not just the menstrual bleeding part, the menstruation part, but the actual day one to day one component. And so some of that work that we're doing is trying to get the cycle to some level of regularity where the person knows, okay, you're ovulating now, because while you're looking at your cervical mucus, some people don't even have any cervical mucus or know when and how to check it. And so those are things that we don't even have to argue about. If you're seeing cervical mucus, now we can time some things because you are ovulating. If you don't know how to look for those things, now it's my job to help you start ovulating. Or, wow, your cycle length is too short, or your cycle length is too long, or you have a blocked tube. All of these things we can work with, but it depends on what you already know about your cycle or don't know about your cycle. And I think unexplained infertility is one of those catch-all phrases because people don't take the time to do the proper examination, not just physically, but to ask the right questions. And sometimes simply asking the right questions, I find out your cycles are too short, or you're ovulating early in day 10. And if you're ovulating at day 10, the egg isn't mature enough. Even again, if there's perfect sperm, it's not, it's not going to be fertilized well enough to implant. Sometimes it's like, the uterine lining is too thin because the luteal phase is too short. And then my favorite, sometimes it's not the woman. Sometimes it's her male partner.
God, yes.
Who refuses to get checked, who refuses to go get a sperm analysis,
I've even heard some REs not even asking about the husband. I'm like, what?
Which is criminal. Yeah. To me, that's criminal.
It's so bad.
Yeah, it is worse than that because now you have this woman jumping through all these hoops, getting pricked and prodded and poked and stabbed and all these things, and it's like, wait a minute, do we know what your partner's sperm analysis is? Have we? Yeah. Has he had it? He knows his sperm as well. Based on what? Because he can ejaculate. Do you know the contents of that?
Right, exactly.
Can you tell me? Can he tell me? Can he tell me what the semen concentration is? Can he tell me what the sperm count is? Can he tell me what the sperm shape is? Can he tell me what the motility is? If he can tell me those 4 things every time he ejaculates, then we have no problem. The fact is he can't. And until you get an examination, none of us can. Somebody has to look at those things. And it could be, oh, yes, he has great sperm count, but are they messed up from years of, let's say, smoking or a simple thing is he's a avid bike rider, and that will affect sperm. But there are things that we can do even with men that are easier than the things that we do with men. They can take their herbal blend, and in 2 months, boom, sperm count is healthy.
Totally.
Because men, make sperm.
It's more simple.
Yeah, it's just definitely simpler. So it's not as invasive. It doesn't require as much. Definitely changing some habits and making some lifestyle changes. But I think that's my biggest pet peeve, is that we are still not addressing male and female factor. And when they're both male and female factor issues, both of them need to be addressed. And a lot of times partners are just not willing to do that. And that can be diagnostic in terms of the healthiness of that relationship.
Yes. And also, I mean, I love that you mentioned birth control, because so many doctors will put people, including myself when I was younger, like on the birth control pill, and be like, okay, when you're ready to get pregnant, you just get off and you just try.
No.
Right?
It doesn't work that way.
It's just, no, it does not.
And I wish it would. Then we wouldn't have as many of these problems. You could just stay on the birth control pill till you were ready, and boom, as soon as you stop taking your pill, everything. But it doesn't work that way. It hijacks your body's endocrine system. And so just because you stop taking it, it has met a threshold. And I say, if you were on it for 6 years, it's going to take a lot of intensive work to clear that actual synthetic hormone from your body and help your body realize what its endogenous hormones are supposed to be doing, because they've been unemployed for the entire time that you're on birth control.
It's true. Yeah.
Yeah. So it's just not that easy.
It hasn't been used.
That has not been, people don't necessarily educate clients and their patients about that turnaround time, and they're misinformed. And unfortunately, that misinformation leads to potentially some life changes and lifestyle changes that aren't taking place when they could and should be happening, and unnecessary and undue harms when people are trying to conceive. Yeah,
for sure. So for people who are trying to conceive, what are some of the steps they should take with doctors? Like, how should they find the right practitioner? Like, it's a game changer when you find the right practitioner.
Yeah, I think the first thing is being like, do some research, find out people who had some, great relationships, but don't necessarily take that for, the lock, stock, and barrel, because it could be, hey, this person liked them because they were in and out. They told them what to do, how to do it, and they just did it and they appreciated that. Some people want a little bit more hand holding. They want to feel coddled. And I will say the IVF industry, or the, ART as an industry, is not about a lot of soft and mushy, cuddly aspect. They're a machine. They get people in so they can get people out, and, cycle after cycle. And if your provider is just like, okay, you had an unsuccessful cycle, and they're like, okay, we'll try again next month, or we can start again next month, that's a red flag. Your body's not ready. Your body is not ready.
Oh my God,
for
I'm
another
so
cycle.
happy you're saying this.
It just is not going to happen.
Thank you, Lorena.
Yes.
Honestly, that is, it's so important.
Yes. And that's money. Your body is not ready. If you had, let's say you went through everything, and in what month are we in? August, it was an unsuccessful, whether it be a transfer or a retrieval. And they're like, okay, we'll try again in September. Your body is so not ready for that experience. And I believe the industry as a whole preys on women and their vulnerability and their desperation. For some women, yes, they undergo 5-6 cycles and they're successful. I am under the guise that after 3 cycles, especially with no time in between, enough time for restoration and ability to recover, it's not going to happen. And does it happen? Yes, absolutely, all the time. But that's not a guarantee. A lot of people think, oh, I'm going to do IVF and I'm guaranteed a baby. The answer is you're not. And it costs a lot of money for IVF. So going back to that original question, what should you be doing? There's a thing called preconception care. How are you taking care of your body before you even start to try to get pregnant? Most people try to the moment they're trying, they're like, I'm going to get healthy once I get pregnant. That is the worst time to start trying any new exercise routine, new dietary lifestyle change. That stuff happens before you get pregnant. That's the first thing. And then it's the interconception care. What are you doing if you're planning on getting pregnant again? What are you doing during that time? And really being able to do some of these things. Like, a lot of people will come to me and they're like, oh, having my transfer today. Can I come in and get an acupuncture treatment? Or I'm having my transfer today and I've never seen them before. And my thing is, absolutely. But keep in mind, these things work better and best as preconception care when you've been seeing your acupuncturist, you've been seeing your massage therapist, you've been seeing, sometimes you've been seeing your own mental health therapist before or leading up to trying to get pregnant. And not everybody has this luxury because they get pregnant by accident or it wasn't planned. But for those who are planning or even thinking about it, start working on yourself months ahead of time, at least 3. And the older you are, probably 6, because your body's doing different things. Your hormones are doing different things. And especially if your hormones or your menstrual cycle is not regular or short, or there's some other type of aberration, whether it's long, short, irregular, you have fibroids, endometriosis, PCOS, all those things. Oh, you need a lot more time ahead of time in order to make sure that you're prepared for pregnancy. So I think really being able to work with a physician or a provider who is not afraid to work with a traditional medicine provider or team, because again, we're doing a lot of the heavy lifting that they're not going to do, or they can't do, or won't do, because all they're going to do is stick to a protocol. Your injections, it has to be on this day, this time. But the preparation for making sure that goes well starts 3 to 6 months ahead of time.
Yes. Amen. Because I do get people come in like a week before their transfers. And while, yes, it's going to help.
Yeah.
Anything's going to help.
Right.
It's still not the same.
Not.
I wish I had more time, yes. But what can you do? Okay. It's like the time's passed. We're here now. Like, let's just
but that's how they've been educated.
Do what we can.
But that's how they've been educated. Well, acupuncture can work for transfer or retrieval. And so that's what they do. They find any acupuncturist on the corner or in their neighborhood, or, sometimes it's the acupuncturist in, the facility that they, they happen to be using for their, ART or their IVF. And that's what they do. Even if that person has direct specialization in gynecology and obstetrics issues associated with balancing the things that may be off because of IVF. And I think a lot of times we forget that IVF is still a synthetic process. Yes, it's getting you to a place, but you're being pumped with hormones at a level that are ungodly in terms of what your body produces normally. They are synthetic. Yeah. And so that's when a lot of women start being sad and depressed and bloating and crampy and angry and mood swings and all these things and water retention. And they're like, I'm just trying to get pregnant. And your body turns into a completely different entity that you are not familiar with because you're undergoing a process that is not natural, that is not, especially in terms of hormone production, that you're getting in ways that are your body was never designed to experience. And yes, it is a means to an end for some people. But there also needs to be a way to balance that so that while this aspect is happening, the Western medicine side has its place, but there also needs to be space created for the traditional medicine side that can balance some of those things while you're going forward and toward accomplishing that goal of conception and healthy pregnancy.
Yeah. For sure. And also having a little, when you were talking about a breather for your body.
Yeah.
And just really like supporting the liver, supporting the detoxification of those excess hormones. And because then you allow your body to kind of come back to that homeostasis.
Yep.
It's really important to do that. Our bodies are just not machines. I mean, it's important to respect that, the process of our bodies and really what they're going through. And I think that is something that needs to be thought of for sure. And another thing that drives me crazy, we were talking about the I word, is geriatric pregnancy at 35 years old. I see an eye roll. I knew you were going to feel the same way. It's absolutely ridiculous.
We have the finite, we have a finite amount of eggs. That's not that I'm not going to even begin to argue about that. But first we need to realize that the egg quality, some of those things were influenced by our moms and our grandmas. So when you were born, some of your eggs it was your grandma and your mom's fault. Like that's just, you got what they gave you. But then at 35, yes, things do change a little bit, but it's not a cliff. You're not like dropping off a cliff and everything is dried up. And the whole geriatric pregnancy nomenclature, it's just like, how are we doing this? Ridiculous. How are we doing this to women? And why? And why are you scaring them into thinking that at 35, if it's not done, wrap it up? Because we've seen people, especially with acupuncture, they're in their 50s. They're still menstruating. And my thing is, if you're still menstruating, there's an egg in there somewhere. Again, what the quality is, I don't know. But there's an egg in there somewhere. And are you ovulating? Not sure. But if you believe it, and we've done your AMH and we're looking at your FSH, and and so 52 has been my oldest client that has gotten using her own eggs. But and she had IVF too, but there were her own eggs and everything else. But we worked together because she needed the extra help that IVF was definitely not going to provide. And through that process of nurturing her, building up her yin, building up her kidney function, all those things that they're not even beginning to talk about in Western medicine. It's like, oh, you need an egg donor. Based on what? Because she's 50? That's not enough.
Right.
That is not an answer. Your age is just not enough. And egg quality is a thing. Egg count is a thing. All those are definitely aspects that need to be taken into consideration, but everybody's not born the same. So there's premature menopause where you're in your 40s or earlier than your 40s, and you have no more eggs and you hit premature menopause. But that's also not always just because there's signs doesn't mean, or symptoms doesn't mean that's the actual diagnosis. Said, main client, she came in and they told her she was, premature ovarian failure and she was hitting early menopause. And I looked at her and I was like, your constitution just, even when she came to the office, I was like, I don't think so.
I know you could see it.
Yeah. I was like, maybe, but because it does exist, but her pulses and everything were vibrant. She was strong. Just constitutionally, she did not look that way. And I said, let's give it 3 months. And in 3 months, not only was she pregnant, she's gotten pregnant again after that. And
I had the same thing. I had similar stories. It's crazy. Yeah.
And I'm like, why give somebody you just told someone who's like, at that time, she wasn't even early. She was maybe not even 40 yet. And they were like, yeah, you're premature ovarian failure. You're going to need an egg donor. all these things. And I'm thinking, it just didn't resonate with me. And again, could have been 100% wrong. But my thing is, you just need to tweak the things that are imbalanced. And for her to have a baby, and again, natural pregnancy, there was no IVF, there was no nothing. And in 3 months of working together, not only was she pregnant, but we continue working together and she's pregnant again. And it's like, so how do you
Amazing.
tell
I love those
that?
stories.
Yeah, you tell somebody that, but that messes with someone's psyche. Someone who's been planning
for sure.
and now they think that they have received what I call a reproductive health death sentence, because they not only are their dreams not going to come true, now they have to reroute everything. And my thing is, not only is it not like we got one, no, you've had two. And now she's like, I don't want another one. But if, she's like, I know definitely working with you, if I don't want another one, I need to make sure my appointments are scheduled sporadically, because she's like, you will get us pregnant.
That is so funny.
And so it's just one of those things, like, that frustrates me. The nomenclature that we use.
Well, it's the power of suggestion, right?
Yes,
I mean, you're looking to an authority figure and you're getting this diagnosis and you're like, okay, well, I guess that's that's what it is. That's my future.
What it is, yeah. And it's not only disempowering, but it's also setting someone else up to not believe in themselves, to not understand their bodies in a way that dispel that information or go in contra. Because if your doctor says it, that, hey, you're in premature ovarian failure, why wouldn't you believe them? And unfortunately, it takes someone like me, our team, to be like, I don't know. It could be true, but something's not matching up. And I think so often we get to that place at around 35 where doctors are just quick to say, okay, well, you're going to definitely have to have IVF, or you're definitely going to have this, or you're definitely going to have an egg donor because your body won't do XYZ anymore. Based on what? Yes, your AMH is a little higher, but that means we just have to work a little harder or a little longer to counteract those natural processes of life by helping your body remember what it can do. And that does mean making some lifestyle changes.
That.
Because your body still can do it. It's just saying, hey, it's a lot harder now. But also, what are you willing to do? Are you willing to make lifestyle changes? Stop eating some of the things that you've been eating. Stop going some of the places that you've been doing. Start getting some sleep that you haven't been doing or getting. You may need to have 7 hours of sleep instead of trying to survive on 4, because you need that restoration for your body, for your cells, for your eggs, for your ovaries. So your body can do that work. You may need to eat different types of food, eat differently. And maybe you might need a massage, or you might need something for stress relief, or you might need some acupuncture and some herbal blend. You might need some of those things to help your body recalibrate so it knows and remembers what it is capable of doing. But staying on that same path, you're right. It might be a dead end, but there's also a way to turn that around. And when we do those things, anything is possible.
I just love that sentence, that you help your body remember, because it's true. Your body knows. Your body's so smart and intelligent. It was designed to self-heal. Yep. That's really at the core of Chinese medicine. Naturopathic medicine says it too. It's really knowing that even Western medicine, they call it homeostasis. We call it yin and yang balance.
Right.
But ultimately, you create that environment where your body comes back to itself.
Yes.
And that's the beauty, is that we do have resilient bodies and we have that ability. I think that that's just remembering and having that hope that just because it's not showing up that way now or expressing itself that way now doesn't mean it's never going to. It's just making those shifts. I think a big hurdle is really changing habits. People love their habits. They love their routines. Even if it's not the healthiest, and sometimes even the husbands, like, to try to get them to stop drinking as much or whatever,
or smoking,
whatever it is,
or bike riding, whatever, or sitting in a sauna, all those different things. Yes, they provide a benefit, but they're not providing the benefit that you need right now. And all of us have habits, and all of those habits address some need that we have. Otherwise they wouldn't be habits, the good ones and the bad ones. We all have vices, and sometimes they're vices that are air quote healthy vices, but sometimes they're vices that we know aren't good for us, but it feeds some type of initial need. But when it's time to do this type of work, which is the growing of a baby, the creation of a baby, we've got to make those shifts, because now baby is requiring more of us than we require of ourselves. And I think that's That's the bottom line, is that baby's going to get theirs first. And if you're not ready to create space for that baby to have a healthy environment, maybe that's not your priority. And I think that's a lot of times when, things aren't necessarily happening. It's that wake up call, like, oh, I need to take a step back. And some of these things that are self-serving now that energy needs to go toward serving, the baby in terms of not its growth and development, not just in utero, but preconception wise. And I think when people make those shifts, that's their first step in motherhood, is doing something in service to their unborn baby, even preconception wise. And when they make that shift, it's like, oh, this is motherhood. This is that service to something bigger than me, which is that pregnancy, and not just for that 9 months, but before baby's even conceived.
Yeah, no doubt. Amazing. I mean, I can talk to you for hours.
Of course, I know. I love talking to you.
The fact that you have such a beautiful perspective, and you really look at like every aspect and kind of like the core of a person, spirit wise, mental wise, physical wise, like in all different ways. And I think it's really cool to have the vantage point that you have, both worlds. I do believe that the two need to work together because there's benefits from every perspective. For people who want to find out more, you have an amazing podcast. So if they want to learn from you, or if they might live close to you and can actually see you in person, how can people find you?
Go to our website, lorenawhite.com. That's my first and last name. And we do telehealth visits, so you don't even have to be in the DC metro area. We have a network of providers all around the country. So even if it's not us, and maybe you're working with us in some virtual component or remote component, and we'll connect you with a provider in your area who does the work that we do, that we believe in, that we trust, and we coordinate care.
I love that.
So it won't necessarily be disjointed. We definitely talk about, all the different aspects that we just talked about here. Just so we're all on the same page and, really working together with you. Because for me, it's more important that our clients receive what they need, and not, even if it's not with us. And I'm not too proud to say like, hey, maybe somebody else can do this better or differently. And maybe I'm not everybody's cup of tea, but I do want everyone to get the things that they need. Again, the podcast is also on our website, and I'll make sure that, the link goes in the show notes as well. And the ability to work with us, I teach. So I always have courses online as well for providers and clients alike. Sometimes providers want to get information because we do have, we address complex.
And we do have a lot of providers listening to this podcast, by the way.
Yeah. And it's because I have my own set of mentors who I feel like they have gotten, I study, I love what I do. And I feel the only way to get better is continuing to do the thing that I do well better. Because if I can, get great results in 3 months, what if I could get those same results in 2.5? Again, those 2 weeks mean something. And so really being able to not only open up my network of other providers who not necessarily are like me, because there are not many, but if I can find an acupuncturist in your city or state who works with, Western medicine providers who are open to that partnership, that's gold. That is gold.
Yes.
I find that it is challenging. Sometimes we'll work with everybody. Because I don't have any shame, and I definitely have confidence in my own skill set, and I will work with anyone at the behest of what's best for our clients. And a lot of times other providers, because I do use traditional medicine for a lot, they think it's, I guess, threatening their practice or what they're, and in the bigger scheme of things, if we're helping our mutual client get their needs met, who cares who gets the credit? The point is, like, it's just, to me, it's one of those like wasted energy aspects, because we're not working for our own reputations. We're working for the benefit of the client. And if we're working together, we all win.
Oh, I love that.
This is why I love you. It's because it just, I don't know, to me, it's all common sense, but I realize the longer I do this, common sense is just not that common. And we're still like, battling, egos and all the different other ills of the world. And that's the one thing is just continue to doing the things and the work that I know works. And again, if you go to the website and and the email, you'll be able to find us anywhere. And if we can't help you, then we'll know someone who can.
Thank you so much for coming on the podcast and sharing your wisdom. And it was really important for me, for the listeners, to hear really what you can get from a healthcare provider and what you should be getting from a healthcare provider.
Yes.
So thank you so much for coming on today.
And thank you for allowing me to be your guest. I appreciate it. You know, I love talking to you as well.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.